Hello, everyone, and welcome to Yera's Corner on the Supernatural Women International channel. When it comes to pregnancy, there are some topics that are considered elephants in the room, and today we'll be looking at one of those topics. Should pregnant women be bleaching their skin? Now, the skin is the largest organ in the body. We already know other parts of our bodies, even with our layman knowledge. If we're asked about the different organs of the body, it's easy to mention them, both the ones that are external and the ones that are internal. But most times, people do not know that the skin is actually the largest organ in the body. And being the largest organ in the body, it serves a lot of purposes, right? Some of these purposes say protection. The skin protects us from a lot of things, like staying and serving as a barrier between our environment and then protecting the internal organs of the body. Is one of the major functions of the skin. The skin also does absorption. So just like when you take in food and your body digests the food, the skin has the ability to also absorb things, from the external surface or the external environment into your body. So absorption is one of the major functions of the skin. The skin also excretes by eliminating toxins and waste from the body. So if you know other orifices, is that orifices or orifice? You have your eyes where tears come out, you have your ears, earwax, you have your mouth, saliva, and you have your perineal area where you urinate and defecate. So these are channels that the body excretes waste products, right? Now the skin is also very important because the skin takes part in excretion, removing toxins from the body, through sweat, oils, it comes out from the pores that exist on the layers of the skin. Now, the skin also secretes, yes. So the skin is part of the endocrine system that secretes hormones. I'm sure that being pregnant, you're already familiar with hormones of the body. So the skin participates, has its own role in the, hormonal system. The skin also does the function of regulation. So regulation in the sense that it regulates body temperature. So when you are cold, when you're hot, change of environment, so many things that happen around you. What your skin does is also to regulate your body temperature. And of course, very importantly, the skin serves as a means of, you getting sensations. So touch and so many other sensations that you feel, and as a means of receiving stimulus, you know, to your body. So, like I said in the beginning, the skin is the largest organ in the body, and of course, being the largest organ, it should be given one of the most attention. There has been like I wouldn't want to call it a pandemic now, but there's a prevalence of lightening the skin, bleaching the skin, and and other different terms that are used in the guise of brightening up, right? And as a result of that, there is like a widespread of different cosmetic products, both the locally manufactured products, foreign products, and the rest of them. Now, how safe these products are for pregnant women is a topic that most times are not really addressed. And today we'll be looking at, things like this. As a pregnant woman, should you really be bleaching your skin? Are there products that you should stay away from, aside from skin bleaching, like generally when you're pregnant and you have like a range of products that you were using, are you supposed to continue using them all through your pregnancy? Do they have any side effects on your baby and all that? We'll be looking at that. We'll be looking into that today. And this is a very long intro, but we're already in the topic. So now that we understand the functions of the skin, We know that the skin has three layers, right? So we have the superficial, which is like the epidermis, then we have the mid layer, which is the dermis, and then we have the inner layer, which is the hypodermis. Now, these three layers all participate in the functions that were listed earlier, right? For a pregnant woman, there are certain skin products or chemicals that you're supposed to avoid because they have the tendency of being absorbed into your skin, and then they have entrance into your body, and some of them are able to actually penetrate the placenta and have negative effects on your body, right? So what are these chemicals? The first one we'll be looking at are retinoids. Retinoids are chemicals that are used for anti-aging or anti-wrinkle products. So there are lots of products that are like anti-aging range. These are not for bleaching particularly or per se, but they are products that are supposed to, rejuvenate your skin and all that. So once you get pregnant, you are supposed to stay away from any product that has retinoids, right? Because they are not safe for your baby. Then the ogaparapara of them, or hydroquinone. Hydroquinone is one of the major chemicals that are used in bleaching products, whether they call it bleaching, whether they call it skin lightening or toning, whichever word is used to define, the reason why there is hydroquinone in a product. Please, if you are pregnant, stay away from them, right? So hydroquinone is like the chemical that is like the brightening ingredient that is found in um cosmetics products, right? And it's very predominant here, especially for us here in Nigeria and the whole of Africa. So please, if you're pregnant, even if you were using those products before, discontinue them for now. When you've given birth and you've stopped breastfeeding, it's okay if you want to return, to use them. Although ideally you're not supposed to be using any product that has hydroquinone because it is not safe, please. So please don't use products that have hydroquinone if you're pregnant. Also, there are some chemicals that are called endocrine disruptive chemicals. These are chemicals that disrupt, just like I said, endocrine disruptive. So they disrupt the normal hormonal level in your body. And you know that as a pregnant woman, there are certain levels that your hormones are supposed to be, so that your pregnancy will be well maintained and you would, stay till term until you deliver. So like your progesterone, your and your estrogen, yes, all these prolactin, so many, hormones that are supposed to be at their specific levels. There are some chemicals that have the tendency to disrupt, these hormonal levels in your body. So they should not be used, they should not be consumed through your skin via any skincare products. So you have to look out for them. Some of them are like parabens, triclosans, and the rest of them. So what you should do is look at the labels of products to see whether or not they contain these ingredients. Another major one are parabens. You know that for you to actually have a product that you would buy and use for a long period of time, say a year or two, and even before you bought it, it has been on the shelf for a while, there has to be preservatives, and most of these preservatives used are parabens. So parabens, and they have antifungal and antibacterial properties. So they are mostly introduced in cosmetic products to preserve their shelf life, right? So but they are not safe for pregnancy. So please, if you look at the label of a product that you have and there are parabens in it, discontinue usage, please. There are some side effects that have been discovered, or discovered regarding people that used products with parabens during their pregnancy. So you have things like low birth weight. They also have obesity. There are some people that have miscarried their pregnancy. There are some that have impaired growth, impaired fetal growth, and also some behavioral problems. So you don't want any of these things happening to your baby. And the best way to be sure that that doesn't happen is to stay away from products that have parabens. Now, the next chemical are benzoyl peroxides and salicylic acids. You know, benzoyl peroxides are the active ingredients that fight against acne, right? And you know that because of the hormonal changes in pregnancy, pregnant women are prone to having breakouts, having like pimples and the rest of it. So there's this tendency for you to want to treat those pimples. But because they are like pregnancy induced reactions, it is advised that you just let them be. Do not use any product that has benzoyl peroxide or salicylic acid and the rest of them when you are pregnant, because they have not been confirmed to be safe for you and your baby. There are so many other chemicals that you shouldn't expose yourself to. So please take out time and do lots of research when you're pregnant and go through your cosmetic products to be sure that you are using, products that are safe for your baby, because the side effects that have been discovered from all this are very, 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 very terrible. There are some side effects like babies having high blood pressure, fatigue, light sensitivity, numbness, neurologic symptoms like tremors, there's memory loss, irritability, kidney failure, lungs failure, and skin cancer. There are so many side effects of skin bleaching to both you, the mother, and also for your baby. So please and please do not use skin bleaching products if you're pregnant. Do not use skin lightening products. Do not try to alter your skin tone when you are pregnant. Relax, have your baby, nurse your baby, and when you're done with childbirth, you can do whatever it is you need to do to, regain your return to your skincare routine and so many other things. So I hope the video has been helpful to you. Please, if you found it informative, share it with your friends that may need this video, and we'll see you in the next one. Bye.